There you
There we go. Are we ready to
You're
go?
good.
Okay, kids, we're gonna get started this morning. I've already kind of prepared you. Like a little seeds on my mouth. I had a bagel this morning. It was everything bagel, and now I have little black seeds floating around in my mouth. So sorry. It's
I
like,
love those.
you know, you have to get it out. So okay. So welcome everybody to another in-service. Again, we're going back to the basics of what the program's about. And what we're going to be talking about today is medication. I'm actually going to throw a couple other things in here. So, you know, it was going to be boring to begin with, but now it's really going to be boring. I get it. It's no easy way. Try to stay awake. Try to get as much as you can out of this, because this is probably, besides active treatment, one of the most important things that we'll talk about at Alternative Ways. Alternative Ways has a history and a reputation of being an ILP program that does a lot of medication stuff, a lot of medical with clients. So what that means is that we get a lot of referrals for people that have medical issues. So it's up to us to know what we're talking about and be able to advocate for our clients when we take them to the doctors. So I'm talking to you today, both ILS and SLS. So it may be a little confusing because some things apply to SLS that don't apply to ILS, but I'm going to try to weed through it and make sense of it for you guys. Okay. So first of all, Alternative Ways is not a licensed facility. Therefore, we do not pass medication. So those of you in the SLS program, our responsibility is just to make sure that medications are available. So what we do is make sure that they're on auto refill in SLS. In ILS, what that means is that you can't let a client run out of medication. You need to be on top of it if we're working on medical with that client, so that you're calling in the refills and getting that taken care of before they're running out of their medications. We're going to talk a little more about that later. The other thing that's our responsibility is to make sure medications have not expired. Make sure that they're placed correctly in the pill trays if we're doing those for our clients. If there's any change in medication, that it's documented. If there are any side effects of medication, that it's monitored. And the medications are stored safely, and we ensure documentation of all medications taken. SLS, I know you guys have been hammered the last couple of weeks by Tina, by Christina about your MARS. That is so, so, so important. If CVRC walks through the door and they see a hole in that MAR and it's not completed, they're going to say, did that client get that med? And if it's blank, we don't know if that client got their med until we contact you. That could be a potential medication error. And it's not an error on me, it's an error on you. It was your shift. It was your responsibility to be able to pass that medication. We're also going to talk about medication errors in just a few minutes. So let's keep going. There are a couple of different types of medications. There are routine medications and there are PRN medications. A routine medication is just your everyday, Monday through Friday, you know, you take medication once a day or twice a day. That's considered a routine medication. A PRN medication, who knows what a PRN stands for? Anybody? Jennifer?
As needed.
That's correct. So what that means is that if a client has maybe some anti-anxiety medication and they're just through the roof, they're sky high in their medications, and you look at the MAR and you look at their meds and think, oh, wow, they've got a PRN for anxiety. Can you just go ahead and give it because it's right there on the MAR? It's you know, it's noted, she has the meds, and it says it's a PRN. What would you SLS people do? Anybody? Jennifer's not SLS, so she can't answer that for you. Okay, Cindy, I have Cindy here with me. There she is. And what she's saying is that she's going to call the case manager. Yes, you cannot give a PRN in SLS unless the case manager is notified. There are reasons for that. Number one reason is you don't want to duplicate it. Say, for example, a person is working an early shift and they give a PRN and they don't notify management. The next person comes on an hour later and this client's sky high and they need to have a PRN and they're still, you know, wagging out over here. If you don't contact the case manager, we could be giving them double medication, especially if the client didn't sign up on the MAR. So you have to be very, very careful. Our rule of thumb is that we do not give a PRN medication unless the case manager or program manager is notified. Okay, so we got routine medications, we have PRN medications. Drug classifications. There are medications that are considered OTC. What does that mean? Anybody? Jennifer.
Over the counter.
Okay, that means you do not have to have a prescription. You can just walk in a pharmacy and buy it. You're talking Pepto-Bismol, Tylenol, Advil, any of that stuff are considered over-the-counter medications. And then the other classification is just your routine medications that require a prescription. You can't just go get, you know, a cholesterol medication without a prescription. So you have over-the-counter and prescription medications. When we're talking about drug reactions to those medications, there's a couple different forms categorized of drug reactions. The first reaction is a toxic drug reaction. And what that means is that there's too much medication built up in that client's blood. You see this a lot with seizure medications. I don't know if any of you guys have seizures, clients that have seizures that you're dealing with. Who's that? Oh, okay. Sorry. If your clients are dealing with seizures, they're taking seizure medications, and you have to go get their levels checked quite often. If they're on Tegretol, you know, some of the other seizure medications require a blood test every 3 months. Some of them take a blood test every month, and that's to regulate the amount of medication in their blood. There's a fine line of controlling seizures. You have to have enough medication in that client's body to control that seizure, but not too much that it's going to cause a reaction. Some reactions from seizure medications are being off balance or falling or bumping into things. If you have a client that has seizures, that's a tall tale sign that there's maybe too much medication in their system and they need to contact the doctor right away and go get a blood level. That's how it's going to be monitored. The other drug reaction is an adverse drug reaction. Those are just our run-of-the-mill everyday medication reactions. Nausea, vomiting, constipation, diarrhea, headache. Those are all the major signs that can happen as a reaction to any medication that you take. It's kind of just basic stuff. So one of the things that we have to talk about when we talk about drug reactions is when your client first starts taking a medication. You want to be very careful and you want to monitor for those side effects of that medication, especially if it's a prescription. You know, if it's a prescription and they're just starting possibly to take a blood pressure medication, you want to monitor that client. You want to make sure they're not getting dizzy. You want to make sure they don't get dizzy when they stand up from a chair. You need to make sure that they're not having any side effects of that medication. If you notice a side effect of a medication that a client is taking, or you think it might be a side effect, you need to let your case manager know right away. We'll contact the doctor. Sometimes it's just a phone call that says, hey, so-and-so's getting kind of dizzy when he stands up. He just started this new medication. And the doctor may say, that's to be expected. You know, it's okay. It will get better over the next couple of days. So we're good to go. The case manager makes a case note and we move on with life. It could be something worse though, that where a doctor says, oh no, we need you to stop that medication right now and we need him to come in, because it could be an adverse drug reaction, especially if it's swelling or breathing difficulties. Those are obviously 911 emergencies. So when a client first starts a medication, you want to make sure you know what those side effects are. You SLS people, in the front of your client's books should be the list of their medications. The sheets, usually it's the sheets that we get from the pharmacy that will say what the side effects are. So you need to take a look at that stuff and you need to be aware of it. ILS people, if you've taken a client to the doctor and you're, having a prescription filled, you need to look at that sheet. You need to make sure that your client is aware of what medications he's on. We're going to talk about that in a little bit. So any suspicion of a toxic or an adverse reaction, you want to make sure your case manager knows ASAP. Okay. Labeling prescriptions. All the prescriptions out there, this pertains to ILS and LS, have to have a label. I would say prescriptions, not the over-the-counter stuff. It's the prescriptions that we're talking about. It's got to have the name of the consumer. It's got to have the strength of the drug, the dose of the drug, the directions for the use. Sometimes if a medication is changed by a doctor and it's increased, say, from 1 pill to 2 pills, it's a lot of people like to take just a little Sharpie and change that 1 to a 2. Not allowed. Not a good thing. You just need to go and get a new label from the pharmacy. That kind of thing you'll coordinate with your case manager if you're the one that's taking the client to the doctor. For your ILS people, you need to make sure that you get a new label for that bottle for that client to have in their home, because you can't use the Sharpie. That's not a good thing. People get very confused. So when you go get that prescription, or you get the prescription from the doctor, you can go right to the pharmacy and say, hey, I need a new label for this pill bottle. And they'll give you one. Okay, now we're going to talk about actually passing the medication. The procedure. Number 1, you don't give any drugs that have changed color, consistency, odor, or they're expired. So if you open a liquid and it's stinky and it's rancid, don't give it. We need to probably get a new bottle. Ensure clients have at least 4 ounces of water to take with their medication. And the last thing is very serious: no crushing or hiding of medications. You could only crush it if your doctor says that it's okay to crush it, and you can only hide it if your IDT team says so. We don't have any clients in our program that we can hide medications from. That's a violation of their rights. And that is a big, big, big no-no. So don't try to stick it in their potatoes or their applesauce. That is a violation. What we can do at the IDT meetings, which you guys know what those are because we talked about them at the last in-service, you can sit down and say, we're having this problem with this client. They're not wanting to take their medication. The IDT team can agree and then take it to the powers to be at regional center to give an okay to do that. It's not going to happen with any of our clients. Our clients are way too high functioning, way too capable. It's mainly for lower functioning clients that they have issues of them swallowing pills, or they're just not going to put a tablet in their mouth and swallow it, but they will swallow it in some pudding. So it's not really going to pertain to us, but just remember, you can't sneak that anti-anxiety medication into a cup of pudding. Okay. I'm going to backtrack just a little bit about crushing the medications. No. Some of the medications that we give our clients are enteric coated. What that means is that there's a coating around the medication that leaks off through the day. They may be good for 12 hours or 14 hours or 24 hours. So little by little, that medication is being dissolved in that client's stomach and they're getting just a little bit at a time. Maybe to control their blood pressure for 24 hours. Don't know. So when you crush that tablet and you're giving all that client all that medication at once, not good. You could kill them. You technically could bottom out their blood pressure, and it's serious. So we don't cut, crush, nothing with the pills unless we're told to do so by the doctor. Now, when you take a client to the doctor can say, this client's on 10 milligrams of this medication, you need to cut it in half. Okay, we've got approval to do so. Then we get a little pill cutter and we cut them in half. That just saves the client from having to get a new prescription, but it has to be okayed and approved by the doctor. Client's rights. In order for us to have medication available for the clients, we have to ensure that their 5 rights are met. The right drug, the right dose, the right time, the right route, and the right client. You might want to write those down. The right drug, the right client, the right dose, the right route. Did I miss one?
The right time.
Okay. Thank you, Jennifer. Okay, guys, those are the 5 rights. Basically, if we violate any one of those rights, it's considered a medication error. Medication error is very serious, like I talked about before. It not only affects the company and puts us in jeopardy, it affects you. Because when we have to write a special incident report to the regional center, letting them know that we've made a medication error, it doesn't stop there. It goes all the way up to the Department of Developmental Services. Okay, so now all of a sudden they've got your name as a staff that did a medication error. Okay, you go into this little registry that they have there, and maybe 4 months later you commit another med error, or in another job you commit a med error. If you're with the Department of Developmental Services, if you're working for a group home, if you're working for a day program, if you're working for an ILP program, everything's under the Department of Developmental Services. Okay, so they follow you around. They know if you've given, had a medication error, and you can get into some serious trouble. I've actually known a person that was kind of blackballed from the system because they weren't allowed to work in the system anymore because they made too many medication errors. So it can happen. They know. So you need to make sure that you're completing that MAR, that you're passing that medication appropriately, that the medication is available for the client, that you don't forget to give that client their medication at the certain time that they're supposed to have it. I'm mainly talking to your SLS people. However, it crosses over to ILS because a lot of our ILS folks are filling pill trays for our clients. So what that means, you're putting that medication into that pill tray for that client to take. So you're saying if they're taking it Monday and Tuesday and Wednesday and Thursday or Friday, how many pills they're taking. The reason we're doing that is because the clients can't do it for themselves. So we're helping them out by teaching and training them, obviously, to put it in that pill tray. But remember the phrase, if they can't do it or they won't do it, we're going to do it for them. So there you are, filling their pill trays for them. They don't know what you're doing, even though you're saying, okay, this is this medication, you take it on, in the morning, and then you take one at night also. Then you take it the next day, the same. They're like, oh, okay. Some of them just are never going to learn, and they're going to trust that whatever you put in that pill tray is what it should be. So you need to make sure that client is yours. You're responsible for their medication. You need to make sure whatever you're putting in that pill tray is what they should be taking. Okay, so you should have their medication list. You should know what they're taking. You should know when they're taking it, how many milligrams. Is it expired? That's your baby. Okay, that's your responsibility as a direct care staff when you're working ILS. If you have any question about that, you need to talk with your case manager. Because again, if you put 2 pills in that tray and that client takes 2 pills, and now all of a sudden their heart rate is gone through, plummeted, and they end up in the ER and their heart rate is really, really low. And they're going to say to us, what kind of medications is that client taking? And there's a very possibility of you guys saying, well, I gave him his 2 pills this morning. Oops, he was only supposed to have 1 pill in the morning. That's a medication error. So when you're doing medication pill trays, if you are not comfortable with that, and you are not 100% sure you know what medications that client is taking, you need not to do it. You need to talk with your case manager. They can come out and sit with you and say, this is the medications that this client's supposed to be on. This is how you fill a pill tray. I think it's very easy to do, but nursing is my background. So I would think, okay, everybody can do that. Well, not everybody knows that stuff. And we understand that. But if you feel uncomfortable at all, you need to make sure you let us know, and we'll do some further training. Everybody got that? Say yes. Okay. So we talked about medication errors. We're going to talk about charting a little bit. When you take a client to the doctor, whether it's ILS or SLS, you need to make sure that you chart everything on that client that happened at the doctor. One of the main things CVRC is looking for are weights. So any information you can obtain from that doctor in a doctor visit, you want to make sure that you get it, whether it be lab results, whether it be an MRI result or a CAT scan results, or whatever you can get us a copy, because CVRC is going to want it and our case managers need it for the reports. Usually when a client goes to the doctor, when they leave, they'll print out what happened at this visit. Get a copy of that. Get 2 copies. Give 1 to the client and you keep 1, so that can be forwarded to the case manager. You need to make sure that you document your medical stuff in Case Magic or TheraP, whatever the case may be. It needs to be very thorough about what you report at the doctor. Something like, I took Fred to the doctor to follow up on his lab work. He had a good visit. That doesn't tell us anything, okay? You need to tell us what doctor Fred went to. You need to tell us if there were any discrepancies in his lab work. If there were, what was the doctor going to do about it? Were they sending him to, a specialist? Were they putting him on medications? Were they changing any of his current medications? All that stuff needs to be in your charting that you guys are doing, okay? Weights, heights, blood pressures, all that basic vital signs needs to be on there. The weight is a #1 sign to tell if there's something going on with the client. If you get a client and all of a sudden they're starting to drop weight, there's probably a problem if they're not trying. If they're dropping 5 pounds this week and 10 pounds that next month, and there's a problem. And that means we need to get them to the doctor and figure out what the heck's going on. But weight is a number one sign that there's something going on. That's why the regional center is all about the weight. You guys know in IDT meetings, one of the first things they say in a meeting, what's their weight? Or do you have it reported? They want it on the paper so they can keep track of it. So that's charting. Refills. Let's talk about refill medications. It's our responsibility, as we talked about before, to make sure the clients have their medication. And what that requires of us is medication refills. So we'll talk about the SLS stuff real quick. If you see a medication running low on one of your SLS people, you need to notify your case manager ASAP, okay? Because she'll take care of that. On the ILS sign, that's you. That's all you. You need to make sure that that client's medications get filled. So what I suggest, if you're a staff that is working on medications and doing pill trace and things like that, I suggest that you meet with that client on a Tuesday or Wednesday to do this stuff. Because you don't want to meet with them Thursday or Friday, because if all of a sudden you find out that a medication, they only have 2 pills left and oh my gosh, it was not refilled, you're stuck. You're stuck like Chuck, especially if that medication requires a refill from the doctor, because you're not going to get it before that client runs out of medication. If that client runs out of medication and it's not available to take for them, what is that? Uh-oh, hang on a minute. What this is saying upgrade. What do I do?
Just upgrade it.
I don't know. I seriously push it? No, see, it's gonna tell me to upgrade all this stuff. No, that's not what I want. Sorry, guys, hang on. Can you grab Tina? It's still working. Oh. I thought we had 45 minutes or something. Okay, let me just keep going until she does. Okay, so refills, ILS, your responsibility. So schedule your time Wednesday, Thursday to go check out that client. Sorry.
You're still good.
Okay.
Still recording.
Okay.
You see at the top where it says, it's got 10 minutes, so.
Okay. Oh, you can. Okay. Wednesday or Thursday is when, or excuse me, Tuesday or Wednesday is when you should be doing those medication refills. That way, if there is a problem with the refill and the doctor has to get approval, you've got a couple days to work with. Never let that client run out of medication. If you happen to forget to do it on Tuesday or Wednesday, or that client was out of town and now they're back and that wasn't well planned in advance to get those filled before they went out of town. If it's Friday and you don't have medications, you need to get in touch with your case manager, because we're going to have to be doing some begging from the doctor, from the pharmacist, to get a couple more pills to make sure that client has medication through the weekend until we can get that medication approved by the doctor. When you take a client to the doctor, there's a couple things that you need to do. You need to make sure you take the medications or a current list of their medications, all their medications that they're taking, an updated list. If the doctor makes any changes in the medication, you should report that to your case manager right away. Okay. If you're taking a medication to, or if you're taking a client to the doctor, you want to make sure that you know what that client's going to the doctor for. Okay. Why are they there? That's your client. You need to know, and you need to make sure that you're documenting after the visit. Okay, we're going to talk SLS for a real quick short minute. ILS, you can close your eye or close your ears. So you SLS people, when you walk into a client's home, the first thing that you need to do is say hello to the client. The second thing you need to do is follow the COVID precautions. Remember, we're still on COVID stuff. You still have to be doing the health screening. You still have to be taking the temperatures. Same thing with you ILS people. But in an SLS situation, the next thing that you need to do is go to your book and go to your MAR. You need to see if that client has any medication changes whatsoever. If they've had a medication change, you need to know that. Maybe their 10 o'clock med that you thought, oh, they take a 10 o'clock med every day, was now changed to 9 o'clock and you didn't know about it. So now it's 10 o'clock, you're ready to give that medication, and now you open the book and dang it, you should have given that medication an hour ago. So you need to be aware if there's any changes in that client at all. That also will tell you if a PRN was given for that client. If you walk in and you're just coming in on shift, you don't know if that client already received a PRN. Okay, so you need to make sure that you check the book and make sure that you wash your hands. And then when you leave the home, you also want to make sure that you wash your hands before you go out. Okay? All right, let's talk about that can go. All right, I'm gonna mix some kind of ILS stuff in here. I don't know if I'm gonna get to all this. Okay, let's talk about, okay, I want you guys to all unmute. Because I want you guys, not Jennifer, to answer this. I want everybody else to be involved in this. So if you guys could all unmute, please. Thank you. Okay, when you take a client to the doctor, what do you need to take? Just yell it out.
It's medications.
Yep, what else? You need to know what you're taking the client for. What are they being followed up for? When you take a client to a medical or dental appointment, what do you do if a client won't let you go in the back with them? I'm sure nobody's had that problem before. So you're at the doctor's office with Fred, and Fred says, nah, I don't want you to go in the back today. I got this one. What are you gonna do?
Ask for a visit summary.
Yes, perfect. That's part of it. So if you've got a client that doesn't want you to go in the back with them, you're probably going to know that in advance. So you can start talking about that on the drive over. That's the teaching and training, active treatment, right? You know, this is going to probably be an issue. This client's very private, especially if it's something private. Okay. They don't want the whole world to know. So you can talk about it. What are we going to see the doctor for today? Well, I think we're gonna get my lab work. What else do you want to talk to the doctor about today? Gosh, I don't know. I was kind of thinking about something private. Whoa, tell me a little more about that. Well, maybe, I don't know, maybe I think I want to talk to him about going on birth control. That's private stuff, right? It's okay if we know it, but that's private stuff. She may not want you in there when she's talking to the doctor about that. So you're going to prep her. Yeah, that's pretty personal, you know, but I really would like to be there so then I can, help you with the doctor. So if you have any questions, I can make sure that you understand about the medication, and you try to convince them to let you go in the back. So now you get to the doctor's office and they call Susie's name, and Susie goes, no, I want to go by myself. It's Susie's right to do that. Absolutely her right to do that. So what you're going to do is you're going to talk to your best friend, the nurse. Okay. You want to make sure that you have the best friend at the doctor's office, that doctor's nurse. You want to know them by name. You want to make sure you say, hey, Julie, how's your day going? Remember me? I'm Cindy. I work with Susie. Okay. Over and over and over, so they know you. So they get very, very familiar with you coming in with Susie. They'll be your best friend. So on that Friday that you forgot to call in those medications and you need to have that prescription called into that doctor right away, you can call your best friend, the nurse, and she'll probably do it for you. If they don't know you from Adam, nah, you're going to get put on a waiting list underneath, 12 more pages of people wanting the same thing. So your best friend, you could give them your med form if you want, or you could ask them, hey, can you get me a copy of the, notes from the doctor after we finish? And if they're your best friend, they'll say, yeah. Okay. That's how we get the information from the doctors. Sometimes the nurses, it doesn't matter if they're not going to be your best friend. They're not going to give you any information. So you can ask the client to ask for the summary, or you just ask the client what happened, on the way home. What you want to make sure though, when you do your charting, if you're asking the client what happened, you want to make sure in your charting you put per client, because it's not verified by you. It's not verified by the doctor. We don't know what the doctor said. This is just what the client is telling us that they said. So work on that. Make sure the client is letting you in. If it's a problem and it continues to be a problem, and you're taking that client to the doctor all the time and they don't let you go in the back, then we probably shouldn't be serving that client. You need to make sure your case manager knows that. So regional center knows that. Because sometimes normally regional center is having us work with that client so we can get the information from the doctor. Maybe the client hasn't been totally honest about what's happening, with their medical services. So that's that. All right. Let me keep going. I'm going to ask you guys a couple more things. Okay, what do you need to do if questions? Okay. Number one, the appointment is just a routine appointment and has no med changes.